Hello, this is Dr. Brooke Patterson, and I would like to speak with you about assessment techniques and general survey. In health assessment, it is important to cultivate your senses. The physical examination requires the use of sight, smell, touch, or hearing. With the exception of some systems, the general order of the skills performed are inspection, palpation, percussion, and auscultation. However, the primary skills we will be using in your first health assessment course are inspection, palpation, and auscultation. Inspection begins when you first meet a person with the general survey. As you proceed through the exam, you will begin with inspection. Remember, inspection always comes first. Requirements for inspection include good lighting and adequate exposure. Even though you may have to expose the patient for a thorough exam, please remember to respect patient dignity and only expose the body part being inspected. There are many instruments you can use for inspection. However, for the purpose of this course, we will be using primarily a pen light. Palpation uses touch to assess texture, temperature, moisture, swelling or edema, vibrations or pulsations, crepitation, rigidity or spasticity, the presence of lumps or masses, and the presence of tenderness or pain. This should be performed slow and systematically. Although there is both light and deep palpation, we will only be doing light palpation in this course. It is noted that different parts of hands are best suited for assessing different factors. Fingertips are best assessing factors such as skin texture, swelling, pulsation, and determining the presence of lumps. The dorsa of the hands and fingers is best for determining temperature. The ulnar surface of the hand is best for feeling vibrations. Although we will not be evaluating percussion in this course, as it is an advanced assessment skill, I want you still to be familiar with percussion and its uses. Percussion involves tapping the person's skin with a hyperextended middle finger. You will then have a striking finger. There will be a picture on the next slide for those of you who are visual learners. It is used for mapping the location and size of organs, detecting abnormal masses, eliciting pain if an underlying structure is inflamed, or eliciting deep tendon reflexes using a percussion hammer. As previously stated, percussion involves a stationary hand with a hyperextended middle finger. You will place a distal joint and tap firmly against the patient's skin. Only the distal joint and tip of the middle finger should be touching the person's skin. You also have the striking hand, in which you will use the middle finger of your dominant hand. You will hold the forearm to the skin surface and strike the tip of the finger. Auscultation allows one to listen to sounds produced by the body. A stethoscope does not magnify sounds, but it does block out extraneous sounds. The fit and quality of the stethoscope is very important. The stethoscope contains a diaphragm that allows you to hear high-pitched sounds and a bell that allows you to hear soft-pitched sounds. Depending on the type of stethoscope you may have, most have a turnable diaphragm that allows you to listen to both high-pitched and soft-pitched sounds. It is also important to have the earpieces facing forward. We will learn more about the stethoscope in practice in lab. The basic principles of auscultation are to eliminate extra noise, to keep your environment comfortable and your stethoscope warm for your patient. Avoid listening over hairy body areas. Never listen through a patient's gown or clothing. Also, it is important to avoid your own artifact or noises, as these can be interpreted as the patient's sounds. It is important to use standard precautions with all patients. Thorough hand hygiene is important in decreasing the spread of infection before and after patient care. Different organizations have different protocols for precautions. It is also important to use protective equipment such as gowns, gloves, masks, eye protection, or face shields if applicable. It is also important to remember respiratory hygiene and cough etiquette. It is important to remember your emotional state and the patient's emotional state while being examined. The patient may be anxious and have anticipation due to being examined by a stranger and having an unknown exam outcome. Reducing anxiety is very important, and if the patient feels more comfortable, the data gathered will best describe the person's natural state. Prior to assessing a patient, vital signs and important measurements will be gathered. You most likely will have a patient change into an examination gown, if applicable, while maintaining privacy and respect. You will then perform hand hygiene and provide thorough explanations to the patient. You will then summarize your exam findings for the person. Developmental competence is very important in mastering assessment skills. Position, preparation, and sequence will vary across the lifespan. For example, exam techniques used for infants and toddlers may be very different than those used for an aging adult. You also need to keep in mind the modifications if a person is ill. You may need to alter positions, adapt the assessment to the patient's comfort level. It may be necessary to complete a focused assessment first, then returning later to finish a complete assessment. Examples of this include a patient who is extremely anxious, agitated, or in pain. When you think about general survey, think about the person as a whole. This includes a general health state with obvious physical characteristics and provides an overall impression. Areas include physical appearance, body structure and mobility, and behavior. Objective data may include the age a person appears, the sexual development appropriate for gender and age, level of consciousness, skin color, facial features, and overall appearance. You can tell a lot by just talking to the person and evaluating appropriate responses. It is also important to note if facial features are symmetric. You can also tell right away if a person is in distress. There is much information that can be gathered by just a general survey. Other objective data may include stature, nutrition, symmetry, posture, and position. It is also important to assess one's mobility. Assessing their gait and foot placement and range of motion is very important in gathering information about the patient's mobility. Facial expressions, mood and affect, and speech can also be assessed. Keep in mind that certain cultures do not prefer to maintain eye contact. It is also important to take a look at the patient's dress and personal hygiene. Different cultures and socioeconomic statuses may affect these factors.